Hello dear students, since a few days we have started with the value added course under pain management, and you have seen the different, like what is pain, what are the risk factors, what are the different type of pain, different theories of pain, how to manage in the hospital. But today we are going to see one of the very important aspect under pain management, that is non-pharmacological management for pain, which is under module 2 unit 3. So let us start with today's session. So this session will include mainly very important aspect like WHO analytic ladder, chemical health education, complementary therapies, education and group therapy, stress management and relaxation. Once we say that WHO analytic ladder, that means it in under the WHO, the World Health Organization has given very systemic guideline for pain management. Then chemical health education, which talks about the different drugs. Complementary therapy talk about non-pharmacological management, diversional therapy, education and group therapy, and stress management and relaxation. So here, module 2 under unit 3, first we are going to see the WHO analgesic ladder. So what is exactly the analgesic ladder? That means what are the steps of managing the pain, we will see in today's session. So outline for this session will be core concept and application of analgesic ladder by WHO. What are the objectives of WHO analgesic ladder? Fundamental principles. Then 3 steps of WHO analgesic ladder. Key principles of WHO analgesic ladder. Revised WHO analgesic ladder and modern adaptation. So here, to introduce this topic, as we know, World Health Organization has given very nicely systematic, well organized guidelines for pain management. When it comes to the systematic manner of pain management, which gives us the guideline to manage the pain and how we are going to approach the patient to relieve the pain. And it has given very concise concept about the pain management in form of ladder. When we say that diagram, you can see there is a WHO analgesic ladder which talks about step 1, step 2, step 3. Step 1 stands for mild pain, step 2 for moderate pain, and step 3 for severe pain. So what is the core concept and application? When we say the pain management, we need to know the how we can relieve the pain or reduce the pain and control the pain, which is effective pain management framework. When we say that there is an acute pain or the chronic pain, which can be relieved by different steps. So WHO analgesic ladder was initially developed for the cancer pain, but now it is used for the acute pain also and chronic pain also. Second is stepwise approach. Stepwise approach, mainly systematic methodological approach, which talks about management of pain under the mild, moderate and severe conditions. The next is the universal application. When we say the universal application, applicable worldwide, globally, when this framework has become a standard in pain management protocol worldwide, offering the healthcare provider to consistent approach for the pain management and directly, indirectly helping to manage the pain. Next, what are the objectives behind this? How we can improve the patient outcome through the structured pain management. So first is a systematic pain management. Second, optimal use of analgesics. Then minimize the unnecessary use of strong opioids and improve quality of life. How it is helpful for the patient in these 4 aspects. First, it gives the guideline to control the pain, and it is very systematic approach to manage the pain. Optimal use of analgesic as per the requirement, as per the need, to avoid the unnecessary overdose of the analgesics. So optimal use of analgesics. Then minimize the unnecessary use of strong opioids. When we say the patient is having severe pain, that means patient is at risk of getting some other complications. So we need to reduce the pain when it is severe. But dose also strong, that is strong opioids are advised. If it is a mild pain with the diversional therapy or any mild dose it is managed, it is okay then. So minimize the unnecessary use of strong opioids. Fourth one, improve the quality of life. Definitely when patient is having pain, that means with pain patient will have a different problems, cannot concentrate on the routine, or patient will not have a normal quality of life. So to improve the quality of life, definitely without pain we will be happy. That means maintain the quality of life. Mainly it talks about the cancer patient. Next is the fundamental principles by the clock, by the mouth, by the ladder. This is a concept, fundamental principle. Under this, the concept by the clock. By the clock, that means as per the time schedule. As if patient require analgesic or painkillers twice a day, once a day. So it talks about by the clock. By the mouth, it is very easy to take the medicine by the mouth. So it is very much necessary. If it is required by the mouth, not necessary to give the intramuscular or IV. It is very helpful for the patient, and easily patient can take medicine by the mouth. By the ladder, that means as per severity of pain, mild, moderate, severe. Accordingly, the administration of or pain management differs. Then there are 3 steps of WHO ladder, mainly mild, moderate and severe. Step 1, step 2, step 3. Already we discussed during that figure. So according to this mild pain or according to step, there are different upwards given to the patient. So when the non-upward analgesics are given, that means the patient will be having mild pain, moderate pain, weak upwards and non-upwards also given. Along with there are specific procedures, and severe pain. So here the examples like paracetamol for mild pain, codeine or tramadol for moderate pain, morphine and oxycodone for the severe pain. So along with that there is a antidepressant, anticonvulsant, antiemetic drugs, and depending on the patient's situation. Then there are key principles of WHO analgesic ladder, mainly stepwise approach, individualization and adjuvant therapy. Stepwise approach, again step 1, step 2, step 3, mild, moderate, severe. As per the step, we have to treat the patient for pain management. Individualization, that means always there will be personal differences, individual differences, definitely, like along with the comorbidity, if patient is having the tolerance power or pain relief, diversional therapy, it depends on the patient, that means individualization. Adjuvant therapy, that means along with the other drug, antidepressant or anticonvulsant, patients are given the analgesics. So there are key principles of WHO analgesic ladder. So additionally there are key factors, regular dosing and monitoring and reassessment. Why this is important? Additional key principles. Regular dosing, that means without assessing the pain level, we cannot give any type of medication or medicine or upwards. So regulating the dose. When pain is less, we need to advise the dose less. When pain is more severe, we need to advise the dose more extra. Monitoring and reassessment is very important. Without monitoring and assessing the pain, we cannot give any type of medicine, or we have to evaluate the pain level and then only we have to administer the medications. Then this is a revised WHO analgesic ladder, and which talks about again the interventional pain management, individualized multimodal analgesic and neuropathic pain. Interventional pain, that means along with this diversional therapy there will be some interventions, like for example spinal anesthesia. It's a very simple example, nerve block, which will be helping the patient to relieve the pain. If there is a neuropathic deficit or there is a neuro pain, so we can advise this interventional pain management. Then individualized multinodal analgesia, again it is helping to relieve the pain by the along with the pharmacological, non-pharmacological, with the medical history or other comorbidity and response of the patient to the treatment. The neuropathic pain consideration, mainly neuropathic pain is significantly it is adjust, and along with that, after severity we need to treat the patient with the neuropathic pain with the nerve block, analgesic and other methods. To summarize this topic, the WHO analgesic ladder is very important, and to summarize this, there are mainly 3 steps, step 1, step 2 and step 3. Step 1 stands for mild pain, and step 2 for severe pain or moderate pain. Step 2 is for moderate pain, and step 3 for the strong upwards required for the severe pain. So depending on the step, depending on the severity of pain, the medications are advised. And WHO has given very nice systematic guidelines for pain management in the form of ladder. So here this was a topic related to under pain management WHO analgesic ladder. Now we'll see the second topic under pain management only, chemical health education. Why this chemical health education is very important under value added course? Chemical health education. Chemical stands for mainly for the medications, drugs, and related to that we need to give health education or making the aware to the patient who is taking analgesics. So this session will include objectives of chemical health education, key component, type of analgesics, benefits, chemical health education doses and administration, preventing misuse and dependency of the analgesics, WHO ladder, what steps are given, patient and family involvement and role of nurse in the chemical health education. So chemical health education in pain management is nothing but it is a teaching the patient, family and healthcare providers about the safe and effective use of chemical agent, that means medications which are used for the relieving the pain or some reducing the complication or reduce the misuse of and dependency. So this is, we can call it is a holistic pain management protocol, which will be directly, indirectly leads to the knowledge, adding to the knowledge, skills and attitude which is necessary for the patient safety to manage the pain. Then next, what are the objectives of chemical health education? So enhance the knowledge, promote safe medication use, encourage compliance, prevent complication and empower self-management. So enhance knowledge in the sense to provide the knowledge about the drug, why drug is necessary, dose regulating is necessary, explain the purposes of it, and we are making them aware. Second, promote the self-medication use. So after advising the medication to the patient, patient should not be underdosed or overdosed. So it should not be misused also. So it is very our responsibility to educate the patient and relatives to minimize the dose or to maintain the dose according to pain level, and there should not be misuse of or dependency on the upwards or analgesics. Encourage the compliance. Ensure patient adheres to prescribed medication regime. Simple example, if patient is taking pain medication or analgesic as per requirement, but frequently patient is taking, frequencies increase, so it is very difficult to manage. So encourage the compliance. Whatever necessary, that much dose patient has to take. Prevent complication. So any drug, any medication for the pain has some or other side effect or some adverse reaction also. So recognize the adverse drug reaction and drug interaction early so that it can be managed. Empower self-management. Very important. We need to teach the patient and patient's relatives to learn about mild to moderate to severe pain and accordingly how the dose is advised. So patient should not take the mild dose for severe pain or patient should not take the extra dose for the mild pain. So empowerment or self-management is very important and it is our role to teach them. Next is key component of analgesia, mainly non-opioid and opioid analgesics are given, and simple example paracetamol, morphine, these are the some of the examples of types of analgesics which is given for the patient with pain. Then what are the benefits of chemical health education? Mainly it helps to improve the pain control, reduce the risk, enhance confidence, safe and rational use of medication. So these are the 4 benefits, important benefits: improve pain control, reduce risk, enhance confidence and safe and rational use of it. Next, what are the doses or administration? And taking medication correctly is essential for safety and effective management of pain. So what is important under this? So proper dosing is very important. Regulating the dose is very, very important. Same thing, like for example, if patient is having mild pain, we cannot advise the medication as compared to severe pain. So proper dosing, or after assessment of pain, we need to reduce the dose or increase the dose. Administration of route. When we say that patient is very happy or easily can take the upwards or analgesic for the pain, mainly oral route is very easily they can take and very comfortably as compared to the intramuscular or IV through. So administration of route is very important, depend on the convenience of the patient and severity of pain. Self-adjustment risk. So avoiding the self-adjustment, that is for example, patient or patient relative should not modify the dose. Whatever prescribed, whatever advised, that much dose they should take for the pain management. There are many side effects and risks for the if patient is taking the opioids or painkiller. So, what are the side effects and how we can make them aware about the risk of managing that side effect. So, common side effects are like nausea, vomiting is very common, drowsiness, sedation if it is extra dose, constipation, dizziness. There are serious adverse effects also. There can be a respiratory depression, because if the percentage of sedation is higher, then it can affect on the liver and kidney, which are vital organs. Then in GI bleeding also very common if patient is taking medication without food, allergic reaction. So this is, we have a very vital role here. So we should make aware, educate the patient, not only the patient but relatives, to understand the side effect, to understand the risk of taking the medication and how to manage it. Then key points of this, preventing the misuse and dependency. Like for example, if patient is taking self medication and it is highly risk, modification of dose or dependency. Whenever patient is having little bit pain, mild pain, easily patient can take the medication. So that leads to the misuse or dependency. So that is also at the risk, and we should also make them educate for this. Safe storage and disposal. Safe storage, why it is necessary for any medication, not only the opioids or analgesics. Any medication, the storage is very important. Checking the expiry date or dose or different aspects of the medication. So proper disposal also is very important. If you don't require any type of painkillers, return to the pharmacy or return to the hospital as per the guidelines given by FDA. So preventing misuse and dependency, a nurse's role is very important here to educate patient and relatives. So as we have seen about the before also, WHO analgesic ladder, which talks about the severity of pain, and we will not go in detail. So patient education and family involvement when patient is taking analgesics. Why it is important? Why the communication between the patient, patient relatives and health professionals are important? Mainly encourage the open communication to the patient, family, healthcare provides. That means pain level and changes in the pain pattern is very important to understand, and depending on that the dose is important. Effectiveness of current medication, side effect, concern about the medication use, impact of pain, and how we can educate the patient and relatives, and how caregiver should be aware about this. Mainly monitoring of the dose, monitoring of the pain, recognizing the side effect of medication, understanding the risk, emergency help, supporting the non-pharmacological management for the pain, and maintaining the medication log or records. So we need to, as a health professional, as a nurse, we should educate the patient and family which is involved in the pain management. And basically first priority goes to the non-pharmacological management, where the second priority goes to the opioids or analgesics. Then to highlight the role of nurse in the chemical health education, first is assessment is very important. Again, assessment of the pain, assessment of the knowledge, fear, belief, medication, dose, side effect, and we should make them understand. Counseling, explaining the purpose of medication, dose, reducing the dose or follow-up, monitoring of the pain as well as monitoring the dose of the medicine, reinforcement to educate or re-educate, we can say reinforce for the avoiding the misuse of analgesics is very important. And collaboration with the pharmacists, doctors, patient, relatives. As a team member, we should help in this matter. So why collaboration is necessary? Because we are working in as a team member, and it is very important to have a holistic care to the patient once it comes to the pain in the cancer patient or pain in the patient which are having the chronic pain. So we have a very major role in the assessment, counseling, monitoring, reinforcement and collaboration. So to summarize these topics, chemical health education is very important. Types of analgesics, benefits, how to educate, then educate to the family, patient and relatives, and nurses role. So another sub point under this pain management, under the module 2 pain management, So complementary therapies in pain management. So we will just see in short what are the complementary therapies, how these complementary therapies helps to manage the pain. So complementary therapy, when we say, it is non-pharmacological approach to control the pain, where the role of medication, role of opioids is reduced. So and this complementary therapy helps to reduce the pain, improve the comfort, enhance the overall well-being. And these therapies are very easy to understand, easy to implement. Mainly it gives aims to address the physical, emotional, psychological and spiritual aspect of pain and provide the holistic approach to the patient care. So there are different therapies available, and what are the objective under these complementary therapies? First, an important objective is to reduce pain. Second, to minimize medication dependency. And third one, promote relaxation. Fourth, enhance or improve the quality of life. And fifth one, support mind-body connection. So these are the 5 objectives of complementary therapy under pain management. So physical therapy is very important. For example, I will not go in detail. There are so many physical therapies for pain management. So massage therapy, heat and cold therapy, then transcutaneous electrical nerve stimulation, which is commonly practiced, acupressure, acupuncture, and there are different therapies available under the physical therapy. Mind body therapies are like meditation, as we know, mindfulness, yoga, then pranayama, guided imagery, relaxation technique. These are the mind body technique which divert the patient from the pain and help to reduce the pain. Then cognitive and behavioral therapy also, commonly we call is a CBT, cognitive behavioral therapy. That means it helps the patient to think on and analyze the behavior, and it is a one type of art how to change the behavior in sense of pain. Biofeedback also, which help to monitor, mainly talks about the mental pain, we can say, along with the physical pain. So biofeedback therapy is also very important for the pain management as a complementary therapy. In herbal and natural therapy, under herbal and natural remedies, there are different therapies like herbal remedies actually for the blocking the impulses of the nerves, support the tissues healing. Then aromatherapy is also very important under the herbal and natural therapy. Then energy based therapies also, like Reiki therapy, as we have seen, the therapeutic touch is very important, magnet therapy, which are helping for the pain management for the patient with the chronic pain. And basically these are practiced in the patient with the cancer pain or carcinoma or rheumatoid arthritis who are having the chronic pain. So what are the role in the nurse in the complementary therapy in pain management? Again, assessment, education, implementation, collaboration, evaluation, which is very important. Assessment of the patient, with how patient is coping with the pain, how he is practicing the therapy, educating them, making them aware about the how to go through. Implementation part, collaboration and evaluation. These are the 5 aspects of role of nurse in the complementary pain management. So there are different advantages also for the complementary therapy, and there are limitations also. If you say the advantages are more as compared to limitations, as it is a holistic approach and it is a non-pharmacological management for pain. So definitely the advantage reduce the dependency on the chemical analgesics upwards. So it reduces the dependency on the drugs, minimize the side effect. As we know, any medication is having the side effect. So it will help to minimize the side effect, promote the holistic healing, enhance the patient satisfaction and comfort, and support patient autonomy. But there are some limitations. Many times what happens, there is no awareness, no education, and many times it is not practiced in the acute pain. Some therapies are like a long-term therapies and may not be like proven. Then the risk of interaction or prescribed medication, there may be a willingness or active participation lacking, and sometimes cost is a factor. So these are the limitations of complementary therapy. So to conclude these complementary therapies as a part of pain management, mainly the complementary therapy is having more benefit as compared to limitation or side effect, and which is very easily everyone can implement to reduce the pain and improve the emotional well-being, enhance the overall quality of life of patient. And definitely, as compared to the medication, these complementary therapies are more beneficial, which will help us or a patient to reduce the side effect of medication. So today we have seen about in this session pain management under the VAC value added course on pain management, mainly the non-pharmacological management. So this session we have finished today. So next session we will have a session 2 also. So if any question, any doubts, you can drop down in the chat box, or you can just share with us so to clarify your doubts. So thank you for patient listening. Thank you.